You take it every night. Maybe it's for your allergies. Maybe it's to help you sleep, or to manage what you call a nervous stomach. You don't think twice about it. It's just a pill. But what if that same little pill was slowly, silently rewiring your brain? What if the very thing you're taking to feel better today is paving the way for dementia tomorrow? Today, we're peeling back the label on a massive class of drugs that millions of people use every day. We're going to talk about the anticholinergic burden, the secret cognitive tax your body might be paying without you even knowing it. What is acetylcholine? To understand the danger, we have to understand a chemical called acetylcholine. Think of it as your brain's high-speed internet. It is a vital neurotransmitter that handles learning, memory, and even your ability to focus. Without it, your brain simply cannot send messages effectively. Now, many common drugs are anticholinergics. Their specific job is to block acetylcholine to stop a symptom, like a runny nose, an overactive bladder, or a muscle spasm. For decades, the medical community thought this was a fair trade-off. But recent massive studies, some involving hundreds of thousands of people over several years, have found a chilling correlation. It isn't just one specific brand, it's a whole group of medications. The risk comes from several common categories. Antihistamines, specifically older ones like diphenhydramine, often found in allergy meds and PM sleep aids. Bladder control medications, used for overactive bladder. Tricyclic antidepressants, used for both mood and chronic pain. Sleep aids, both prescription and over-the-counter varieties. Here is why this feels like a secret danger. If you take one allergy pill for a bee sting, you aren't going to wake up with Alzheimer's. The danger is what doctors call the cumulative anticholinergic burden. Imagine your brain has a buffer. Every time you take these medications, you're using up a bit of that buffer. A landmark 2019 study published in JAMA Internal Medicine found that people over the age of 55 who took strong anticholinergics daily for 3 years or more had a nearly 50% increased risk of dementia. The reason this is so easy to miss is that many of these drugs are available over the counter. We tend to assume that if we don't need a prescription for it, it must be harmless for long-term use. But your brain doesn't care if the pill came from a doctor or a drugstore shelf. The chemical impact is exactly the same. Does it cause or correlate? Now we have to look at the nuance. Scientists are still debating whether these pills cause dementia or if there is a prodromal effect. In other words, are people in the very early, undiagnosed stages of dementia simply taking more sleep and anxiety meds to cope with their emerging symptoms? While the debate continues, the evidence is strong enough that many geriatricians now use something called the Beers criteria. This is a specialized list of potentially inappropriate medications for older adults. Doctors are now actively trying to deprescribe these drugs because they often see brain fog lift almost immediately when a patient switches to a safer alternative. The good news is that for almost every condition these pills treat, there is a brain-safe alternative, whether it's a newer generation of antihistamine that doesn't cross the blood-brain barrier, or non-drug therapies for sleep and anxiety. So what do you do if you're looking at your medicine cabinet right now and seeing one of these bottles? First, do not stop a prescribed medication cold turkey. Especially with antidepressants or anti-anxiety meds, the withdrawal can be physically dangerous. Always consult your doctor first. Second, perform an audit. Look for active ingredients like diphenhydramine or oxybutynin. If you realize you've been taking these daily for months or years, schedule a cognitive audit with your physician to discuss alternatives. Finally, remember that the best pills for your brain aren't in a bottle. Consistent sleep, a healthy diet, and regular exercise are the only interventions proven to reduce dementia risk without any negative side effects. The best way to protect your future self is to be an informed advocate for your current self. Don't let your medication be a secret thief of your memories. Stay curious, stay healthy, and take charge of what goes into your body.